Right. Good evening, everybody, and welcome to this Labour Movement for Europe Zoom meeting. If I could ask people to try and keep themselves on mute when they're not speaking. My name's Alex Mayer. I used to be a member of European Parliament, and I'm a current member of the Labour Movement for Europe. I'm really pleased that we've got a great panel of speakers here this evening. From right across Europe. It's going to be a bit like the Eurovision Song Contest tonight, I think, as I call on different countries to come and speak to us. So the format of tonight is that, first of all, we'll hear from our four speakers, and then it'll be over to you to ask whatever questions you may have. I'm going to ask you to make use of the blue hand that you will find in Zoom. I'm sure many of us have become Zoom aficionados over the last couple of months. So you will find the way to put your blue hand up in the participants section of Zoom, and depending on how you're accessing this meeting, if it's on a PC, it's probably down at the bottom, the participants tab. If it's on an iPad or a tablet, it's probably at the top. But you've got a bit of time to find that, but try and get your questions ready in advance, please. We've also got Harry on the call, who is the organiser of the Labour Movement for Europe, and he will also be explaining how you can join our growing organisation at some stage later on in the call. So, first of all, I'd like to hand over to our first speaker, who is Fausto. He is a trade unionist, and he's come to tell us what the response to coronavirus has been like in Italy. So first of all, over to Fausto. Thank you.
Thank you so much. Hello, everybody. I have only 5 minutes for this intervention, so I will concentrate my speech on how the national health system responded to the pandemic and how people reacted to this kind of response. The first thing we noticed is that something really strange to understand and to accept. We were not autonomous concerning simple but necessary components and machines and tools to tackle this crisis. We had not enough masks, we had not enough plastic components for respirators, we had not beds enough in intensive care structures, and we had to confront ourselves with this new situation, which was completely unbelievable just 1 or 2 weeks before the explosion of the pandemic. And the second point is that we discovered that we are depending on China or on very, very far nations for having this equipment at our disposal in reasonable times. And this is something changing the attitude of people towards the national health system, because the point is that the most important and industrial regions in the north of Italy, just like Lombardia region and Milan, Piedmont region and Turin, and Veneto regions and Venice, they were the worst, they had the worst reaction. The territorial health system of these regions had the worst reaction to the pandemic, in opposition to what happened in Rome or in south of Italy, where the response was clearly better, and the number of people in disease, the number of dead was incredibly low if compared to those of Milan and Turin, for instance. This is to say that what we imagine now is that we have to change our priorities for money invested in national health system. The reason why the more advanced and industrialized regions responded in not an efficient way, this is our opinion, this is our evaluation as trade unions, is that the money invested in public structure in those regions, mainly in the north of Italy, was really, really low. And a lot of money was located to private health structure, which were unable to understand the national scope of this health system, and they have a different attitude towards health as a business. In our opinion, health is not a normal business. Health is something that must work for people, and you cannot consider health system, sanitary system, national structure, public structure like private business. And this is something we are discussing now concerning how to change for the future, because people is aware that if we have a second wave, or if we have in the future a new virus, a new explosion of pandemic, we cannot manage in the same way than we did today. So this means that we have to invest more in the public dimension of health system. We have to invest more in the territorial health system. We have to invest more in the education, in the training of family doctors and of doctors based in the territorial health structure, because they are the first line in replying to an unhappy event like that. And when you decide to dismantle public services and public dimension of health service, when you decide to put money on private health system, the result is that you are weaker than usual when you need to be strong. That's the point that I think normal people is considering now, and this probably will change our attitude towards discussion about public investment in health, as well as in school, in public transport, and other domains of public life. This is the first reaction we can see, and I think that this is something interesting because it reverses a decade, more than a decade of thinking that dismantling public sectors and investing on privatization and on private structure is something good. It's not good. It is good to invest in public, national, and territorial health system because it's the first guarantee for saving lives and for tackle this big crisis.
Brilliant. Thank you ever so much indeed, Fausto. And I think you've got an audience who would very much agree with you on the need to invest in our public health services. Yes, you've got some thumbs ups I can see. So our next speaker is Eva, who is a member of the European Parliament representing Greece. And can I see you somewhere there, Eva? There's so many people on my screens, I can't see everyone anymore. I saw you join. Ah, there you are. Can you unmute, please?
I think you have to unmute her.
Yep. No, are you
okay.
unmuted? You are unmuted. Yes. Excellent.
The
Very
host has to unmute me, but I think I did it already. I managed.
Okay.
So, yes, thank you, Alex. And it's an honor for me to participate. I think Labour Movement for EU is really a very exciting initiative. I'm very sad that this is the year that the day we were actually were very upset because Brexit happened, end of January, would have brought a realization of how important Europe is and how we can integrate faster. And then the coronavirus, this pandemic hit us. So basically, we haven't realized UK left yet. So because we never got back actually to plenary without our UK colleagues. So I think also this pandemic showed us that you can leave EU, but still these challenges, they cannot be stopped by borders. So also the perception is that the UK didn't do as well as expected, delayed to respond, and the prioritization was basically to not disrupt the economy, to support businesses, and the economic damage, the narrative was that the economic damage would actually hurt more people than the pandemic itself. So let's try to see if this pandemic can work and stop if we don't panic. So if you see the results, I would say the perception in the EU is that it's a really bad situation. I have several friends that they either quit their jobs in UK and they're back to Greece. I have friends that they frozen their contracts or they left past the country to come back here. I don't know if they will return actually. I think this indicates the need for a different leadership by the Labour Party. Let me say the Labour mentality, because at this point it's beyond partisan. The response has to do with how much you value safety and how much you value the quality of life to save lives. And although we are in social distance, in physical distance, we are closer than ever because we realize that these challenges are beyond us, beyond borders, and we have to face them together. So in my perspective and my understanding, Europe has managed to act with a small delay because we have not become like a US model. So this means we still have to coordinate, and we don't have a European health policy. We do have recommendations, efforts, pilots, suggestions, but we have not delegated to Europe to help us like with our health systems. It's a national competency. So I have the feeling that even the populists, I don't know if this is the case in UK actually, but I know it's the case in Italy. Even the populists at this point, instead of criticizing Europe, they criticize the fact that Europe was not there also in health policy, which is very interesting. So they want more Europe. This is an incredible contradiction. And I think this is a crisis that will let us get out of this crisis stronger and not weaker. More Europeans, we understand that we can only face it together. And even the German top politicians said that we are a country that exports. So basically, if we don't have Europe recover, this will be a disaster for us. So we cannot do business as usual. We actually have to work together. So this lesson is learned, and it's not a surprise that they even discussed to have a chancellor from the Social Party, Olaf Scholz, who is, I would say, maybe as center as he can be in SPD, but still, even discussing that he should be the one to take over at this point, it shows exactly that the agenda is changing and the priorities too. And of course, we need to redefine the word safety. One of the problems we saw in Europe was the disruption of supply chains inside the EU. So these are the problems we have to fix. Let me say, criticism of our shortcomings doesn't mean I'm attacking Europe. It means that we need a better and more Europe. So we would like to be able to have a center that could coordinate actions. And when Italy needed safety equipment to protect doctors and hospitals, they would not see that the products they ordered and paid were stuck in Germany because Germany said, we might be in need very soon, so we have the right to keep them here. And there were some also legal excuses and technical, bureaucratic excuses. So we have to find ways to have uninterrupted, undisrupted supply chains. The same time, this point today, I think there was an announcement of the list of countries that now are open, and EU seems to finally have a plan. So it's not like everybody will decide who they will open their doors to. So now this means UK is also in this team, because 2020 is the year that still UK is considered to participate in the EU, which means that we are open and we can have flights from and to UK. But imagine what would have happened, or what could happen after 2020 if this pandemic has a second or a third wave, until we have a proper treatment with successful results. Finally, since I'm from Greece, I have to tell you that the fact that Greece was, I would say, trained in difficult conditions, in a survival mode, and actually we were dealing with uncertainties constantly the last decade. We were really prepared for a new difficulty and really fast we adapted. And this helped us overcome any ideological division and suddenly come together and say, no, this is maybe the last challenge that we have to face after austerity, but we will face it together. We are ready to take this difficulty, because at least this difficulty is not systemic. You cannot blame anybody in Europe or a politician. It's not the system. So the forces, even the anti-systemic forces, lost the narrative. And now what we have to do is to reorganize better our coordination. We have to make sure that we will understand the responsibilities of the World Health Organization and improve it, not shut it down. So when something's not working properly, you don't shut it down, you just improve it. You understand you need it even more. And let me also say that we have a European agency that it's called ECDC, is like the European Center for Control and Prevention of Diseases, that managed to acquire and gather and collect 80% of the data from different national systems, health systems across Europe, which means they gathered a lot of data of what's happening, up to 80% of all the cases of coronavirus, with several metrics. And the problem we saw is that we didn't have common standards. So it was really difficult to use the data for scientific research under the regulation, under GDPR. So what we are realizing every day, crossing with reality in this pandemic, is that we definitely need to work together, and we definitely need to have common safety protocols, because by nature, there are some territories, some regions that they are decentralized, they are more isolated, and they were safe. But the countries that were interconnected, and we saw how interconnected we are, we cannot not have a plan. The same time, but I'm sure everybody will talk about that, since we set up very fast by the ECB, and I did everything possible to make sure that SMEs will be protected, startups will be protected, the people that they depend on their everyday work will be protected. And Lagarde came up with a plan of 3 trillion for 3 years, with -1% of rate. This means this is like a first-time thing. We saw the will for liquidity. We saw that we need to take extreme measures. And then we saw Germany and France having to follow up and coming up with a recovery fund. And now we're going to deal with the details, but of course, following also the new waves and see the needs. And then the responsibility of the member states, of course, to allocate properly these funds and not to waste them into like benefits and stuff like that, but like to build also infrastructures and to make our economy resilient. And now the prism of Europe is green technology and digitalization. So everything will happen through that. So finally, it was a catalyst to move and transform every sector. Actually, the transformation was happening, but now the traditional sector and the heavy countries, they understand that you have to adapt to these new technologies to be globally competitive, because we are so interconnected. Thank you so much, Alex.
Thank you, Eva. Thank you ever so much for joining us tonight. And it's really refreshing for a British Labour audience to be hearing a politician talking about working together and cooperation. I'm afraid we've got a Prime Minister at the moment who just talks about world-beating solutions, as if we have to win on our own rather than working out what's actually best for our country and the whole of the rest of Europe and the world. So our next speaker, it's now over to Ireland, and we're next going to hear from Brian Dawson. So Brian, over to you.
Thanks, Alex, and may I say thanks to Fausto and Eva for a very interesting inputs there. So, sitting with you here just outside of Dublin, really we're at a very interesting phase in terms of our COVID journey, and hopefully it'll be a shorter one rather than a longer one. That we have had a reasonably sized outbreak here to date. I was just looking at the figures earlier. We've had 1,736 deaths, but thankfully it's phasing out quite quickly at the moment, whereby there was 1 death today and 0 deaths yesterday. So I suppose just to give you the context of where we are as a state at the moment. Now, I suppose in terms of our response, there's a saying that, economically, if the US catches a cold, then or if the US sneezes, then the world catches a cold. And certainly when it comes to COVID, Ireland and the UK have a very similar relationship, that because there is such strong economic ties, such strong cross-border travel, not only between the two islands, but also obviously between Northern Ireland and Southern Ireland, there has been a very close eye paid in Ireland to how the UK is dealing with COVID. And particularly at the beginning of the outbreak, Ireland had its first case on the 29th of February, and very quickly moved into lockdown, whereas the UK probably was about 8 to 9 days behind Ireland in terms of locking down, which meant obviously in terms of travel and particularly around horse racing festivals, things like Cheltenham, there was real issues around Irish people going to the UK and returning home, potentially carrying COVID, and obviously visitors from other parts of the world as well. So, we have been watching your Prime Minister bumble along, is probably the kindest way I could describe it. And certainly, while I'll try to be fair in some contexts, I think the broad Irish opinion is that the UK government have made an absolute balls of how they've dealt with the COVID outbreak. And to the point that the Irish government has had to work very closely with the Northern Ireland executive to basically frame a different response from the UK mainland in order to protect Irish citizens. And so that has been unfortunate. It wouldn't be the way that we would have hoped that it would have gone in the UK as well as in Ireland, but certainly we have been very focused on our own capacity and how the EU and being part of the EU helps us with that capacity. We are a small nation, less than 4 million people. We also, very interestingly, compared to what Fausto was saying, we have traditionally always had a public and a private healthcare system, so a two-tier healthcare system. And actually the response to COVID was for the government to nationalise the private healthcare system and to make it a single-tier healthcare system for the first time ever in Ireland. So, from a socialist perspective, that is groundbreaking for Ireland, that for the first time ever we had what would be termed an equivalent to the NHS, and that has been an eye-opening experience for Irish people in terms of solidarity and equality of treatment across our healthcare system. It was largely out of necessity that our public healthcare system just didn't have the capacity for the expected surge of cases, but it's certainly something that will, it'll be hard to put that genie back in the box in terms of going back to a two-tier healthcare system. So it's a very interesting dichotomy with what Fausto was describing in Italy. The other, I suppose, elements, certainly the being part of the EU gave us a lot of solidarity, both in terms of learning. Fortunately for us, unfortunately for colleagues elsewhere in Europe, we were probably 1 to 2 weeks behind what they were experiencing. so that we could learn from their experiences, as awful as they were, in terms of what sort of facilities we needed to have set up, what sort of restrictions we needed to be able to put in place, and to be able to learn very, very quickly from even doctors in Spain. We're speaking to doctors in Ireland on how to treat people as the worst of the disease ravaged. And then I suppose, and I'll kind of wrap up quickly enough on this, but looking forward, obviously we don't know what will happen. We are expecting a second surge. How we deal with that is going to be another challenge. But what Europe has allowed Ireland to do, and being part of the European Union has allowed Ireland to do, is to prepare for potential further cases, but also for our recovery. As Eva mentioned, we have been able to borrow on the world markets as a European Union, which means that we can borrow money at much lower rates than Ireland as a unique, small island could ever do. And that has stabilized our economy at a time where obviously our economy was tanking, and has allowed us to have the spending power to provide supports to people who are unemployed, provide supports to people and businesses who just need a bit of liquidity to fill the gap before they can get up and running again. And really, obviously everyone on this call by virtue is a pro-European, but certainly Ireland is a very pro-European country, but I think since the pandemic it's probably even more so. And really the place of a small island nation in a broader club has shown its value. We have had problems, as Eva said, in terms of getting PPE and other challenges, but even on that, the facility that the EU is now putting in place to already think about how we can bulk buy vaccine if hopefully we get to that point. That's what Europe is about. It's about solidarity, forward planning, and using our combined strength to save lives in this case. So I'll obviously thanks for the opportunity to speak to you, and certainly there is a lot of continuing solidarity in Ireland towards the UK, despite the fact that you're leaving the club, and certainly the feeling here in Ireland is we'd prefer if you didn't go. We were absolutely obsessed by everything Brexit for months and months and months here in Ireland. We watched everything that was going on, and the only thing that's been able to knock that off the Irish attention has been a global pandemic. So actually, and in some ways, it's been a bit of a relief from Brexit. I know we shouldn't describe it that way, but it has been. So look, thanks for the opportunity again, and certainly happy to continue the conversation and answer any questions later on.
Thank you so much indeed, Brian. I have to say the same is true of the UK news. It was a global pandemic that was the only thing that managed to push Brexit off our news and indeed out of Westminster. So our next speaker is going to be Jonathan. Before I move to him, just a reminder to everyone to think about what questions you're going to ask and start putting up your blue hands. I can see the first one is already up. Oh, the second one now. So think up of the questions that you're going to ask. So I'm now going to move over to Jonathan Browning. This is a slightly different perspective because Jonathan is going to talk to us about another pandemic. Well, was it a pandemic? About the Ebola outbreak that he was involved in when he was a leader on that for the British in Sierra Leone. So over to Jonathan.
Thanks a lot, Alex. So yeah, unfortunately, COVID-19 ended up being a bit of deja vu for me. So I spent all of 2015 in Sierra Leone, where I was the team leader for the Freetown Ebola response. So that was a combined team of Sierra Leoneans, Brits, civilians and military. And we were managing the overall response, not the medical part, but everything else, the operational piece. And that went on for a very long time. So people had thought it started in August 20, or even earlier than that, 2014. peaked towards the end of 2014. Early 2015 was also quite a peak of cases. And by March, April, they started reducing to only a small number of cases. And people thought, great, we're done, we're almost finished. But we didn't get to 0 cases till October. So 3 big components that really got us to getting the case numbers manageable in Sierra Leone and getting everything to work well was transparency by the government and the Ebola response, making sure that they were transparent and very honest about everything. So nothing went perfectly, nothing went well, always. It had to be changed a bit. And so being transparent about why the changes were happening, why this was happening, why that was happening, why this didn't work, was really important to keep trust. If you try to manage things and avoid being 100% honest, people start to wonder what's happening. Transparency and honesty were key. The other key thing was having the capability to test for cases, be able to actually contact trace those cases in terms of their networks, so you can see who might have been had the disease transmitted. And then when you found those people who were exposed, isolate them, ask them to isolate. And trust me, the quarantines and lockdowns were far harsher in Sierra Leone than here. We had a luxurious version of what they had, unfortunately. And so those 3 components were what got the case numbers really, really low. You know, the population, sorry, there's 3 components. The third component was the population, engaging with the population, making sure the community supported you, really going down to community level and talking to them and promoting why the lockdowns were happening, why the response was needed, and getting them on board, because that local community level, especially when you're starting to do local lockdowns and not just national, it's incredibly important, because human behavior is a key driver of how the transmission either is got under control or gets out of control. And I think we are now seeing that in some states in the US. So I found it really interesting looking at this response, the amount of denial which was happening. So we saw, first of all, a massive number of cases in China, in Wuhan. We saw them locking down millions of people, which had never been done before. When, unfortunately, in northern Italy, we saw a very catastrophic situation at first. I think there were still people in the UK and some other EU states just denying that this was really, really as bad as it was, and underestimating the response that was needed to actually keep the case numbers down. Some countries that did excellently were Greece, Serbia, Czech Republic, Ireland. They understood the need to quickly act, and society as a whole came together to act. And I think that's a lesson to be learned. I think that point about denial is a key thing to think about as we go on. There's a lot of people, I think, who wonder why we're still doing a response. Maybe the problem's gone away, who don't really understand the length and duration of the challenge we have ahead of us. And not only the denial hit me, but when we were doing our response in the UK, just underestimating the scale of the problem. How it is that we didn't have a national pandemic plan in place is just crazy. I think even the EU didn't, and many member states didn't. And, you know, if you look at best cases, best practice, if you look at Singapore, if you look at Taiwan, South Korea, they've done a fantastic job. And why it is we weren't really getting in touch with them and borrowing some of their best practices right as soon as we saw the pandemic emerging in February, I really don't understand. So I think, you know, the EU's got a great chance now to come together, think about what worked, what didn't, and use that as we go ahead into the next few months before the vaccine hopefully becomes available at some point. How we can manage it together as the EU, as a European states in the case of the UK, which is left or is leaving. And I think that's going to be important. So some sort of supranational approach to having a pandemic. And lastly, I'll just end that, you know, the biggest thing I noticed about doing the lockdowns and the response in Sierra Leone, as I said before, was human behavior. And so the science is great to follow. You know, you have to follow the science to make sure the response works. There's a bit of politics in there. And the politics is around the economy, but it's also around human behavior. It's around making sure your population follow you with the response and believe in it. I'll end there and happy to answer any questions.
Brilliant. Thank you so much, Jonathan. So now we've got about 20 minutes for questions. I can see some hands have already gone up. I think given that we've only got 20 minutes, I'm going to try and take 3 or 4 in this first round, because I think we're going to manage to fit 2 rounds in. So I'm going to start with Steve, then Kath, then Patrick, and then Keith. So Steve, I should have unmuted you, so you're up first.
Thank you. Yeah, thank you very much, Alex. This is just an observation more than anything. Excuse me. I think that the reason all these other countries have done so much better, you know, especially New Zealand and most of the EU countries have done so much better than the British government, it's not only because they're not competent enough, which they're not, but they just don't have the DNA to tackle anything like this, because that's what neoliberalism is all about. You know, it's not about the government actually taking action on behalf of the people. And my other comment is that our Prime Minister...
Just a comment briefly, because I want to fit as many people in as we can.
Yeah, Boris seems to be more popular before the outbreak, more popular after the outbreak than before. And if anybody has a logical explanation for that, I'd sure like to hear it.
Very good. Okay, next can I take Kath, please? And can you tell us which part of the country you're from as well?
Hi, I'm based in East Anglia. Alex's question is not going to surprise you, given our work together. I run a not-for-profit that supports parents and carers who support kids and adults who have survived things like childhood sexual abuse, domestic violence, sexual assault, that kind of thing. I'm just really interested to know how much awareness there has been in Europe of these issues in terms of lockdown and isolation, and what the European response has been.
Very good. Patrick from Huntingdonshire.
Okay, thank you, yep. Alex. Patrick here from United Kingdom, Huntingdonshire. Jonathan, I was interested with what you said, transparency, management, and contact trace. At this stage, the society actually came together to respond on this pandemic. My question is, what are the precautions and plans have been put in place by all governments if the new wave comes? Because I can see that most people are not free to think that it is going to end so fast and so quick.
Very good. Finally for this round, Keith, please.
Hello, I'd like to ask Brian about the changes in Ireland, where I might be able to find out more about the changes in the Irish Health Service and whether they're permanent or not.
Very good. Okay, thank you for those questions. So to respond, shall we start with Eva? Eva, are you there? Maybe you're not. No? Okay, in which case, we'll start with Brian. There was one specifically for you there. Brian?
Okay, thank you. Sorry,
sorry, I've still not entirely got the hang of this system.
Look, thanks, Keith. I'll go straight to yourself. In terms of learning about those changes in the Irish healthcare system, I think probably, like Irish media, certainly there's been some good articles in the Sunday Business Post about, you know, if you Google Ireland and single tier healthcare system, there will be a lot of coverage there. Like we've just, I suppose, almost because of our geographic location as much as anything, we've fallen somewhere between an NHS and a US style private system. But you know, certainly that amalgamation has been really significant. But obviously, the government has to give back the private healthcare system, and that is happening basically as we speak. So, but we've just formed a new government. Our entire COVID experience was under a caretaker government who were undergoing government negotiations at the time. But certainly there's a lot of pressure on the new government to build now towards a single-tier healthcare system.
Brilliant, thank you. Fausto, any comments on the questions that were asked?
Yeah, one point. This is clearly a global crisis. Coronavirus is a global issue. The point is that the answer we are giving to this global virus are only national. And there's something wrong in the approach. It's not only wrong in terms of, let's say, of efficiency of sanitary measures, of health measures. It's wrong because it can perpetuate the idea that countries and peoples can solve their problems alone. If there is one chance to tackle with good results this crisis, is to act all together and to give a global crisis a global answer. So this is what we have to, let me say, from a left and from a progressive point of view, this is the point we should insist on, putting pressure on our different governments in order to reach a common point about a European answer to this crisis, which is not only a health crisis, but it's also a crisis of a model of production, a model of way of living, and a model of also having political relations between different countries. And from the citizens' point of view, I have to say we had a different approach. At the beginning, the measures proposed by the government in order to block the diffusion of the disease, to block the new infections cases, they were not so easy to be accepted. But when the numbers of this crisis started to increase in very, very important areas of the country, we were accustomed to think that they were the most modern and the most efficient regions of our country, where the numbers were clear day after day. Also the position of normal people towards the measures prepared and decided by the government was different. Because we understood that if we wanted to save our lives, we had to trust in the provisions of the health minister, in the ideas of the government, in the proposal of the government for the lockdown and for all measures trying to avoid disease, new cases of disease. So this is the point: a global answer at European level, and establishing something related to a new concept of producing and of living in this after-pandemic new era.
Brilliant, thank you so much, Fausto. Jonathan, would you like to respond to any of those points?
Yes, so shall I respond to Patrick's question? If I heard you correctly, you were saying what capacity and capability does the EU have in the future to respond to future spikes? Is that right? Yeah. So, I mean, basically, you know, what they've already put in place now will be the key for any spikes that we have in the future. I don't like the term second wave. I think it misses the point. The point is there's always cases, and then if you reduce them, maybe they increase and there's a spike. So it's going to be contact tracing capability. It's going to be bed capacity, emergency surge bed capacity. It's going to be communications to the people. It's going to be the legal stuff put in place to manage all of that, and if needed, another lockdown. And I think one of the things that many EU countries are struggling with, and certainly the UK, definitely the UK struggling with, is contact tracing. So it's been touted as this app where one phone bumps into another phone and tells people that you've maybe bumped into someone who had COVID-19. I mean, actually, contact tracing is down to just lots of people doing detective type work. So you've got to phone someone who maybe came into contact with someone who had the disease, ask them who those contacts were, contact those other contacts, and follow all of those routes of the transmission chain to try to tell them to isolate and break the transmission chain. So having a nice clever app like South Korea does is brilliant. But if you don't have people in place who can make those phone calls, know what they're doing, persuade people to isolate themselves, because you can't just lock them down, we're not China. Unless you have that capability in place, you're really not going to manage those low numbers lower and lower and lower. So that's key, and I don't think we've done well with that. And, you know, communications, again, I go back to what I said. It's got to be clear, it's got to be honest. And UK recently, we just locked down Leicester again, or told them they can't unlock more than they have. And it's been really poorly done. There's no press briefing about it. It's just very poor. So, you know, we as UK have to get those sort of things better. I hope that answers your question.
Very good. Thanks ever so much, Jonathan. Right, women out there, I need you to put your hands up because I have a male-dominated set of questions coming up. So first of all, I'm going to take Giampi, and then I am going to take John.
Hi. The UK rate of death per million people is the highest in the world. It's quite shocking to see. I keep looking at it and thinking, no, that can't be right. It is right. We have more people dying and have died here per 1 million people than Italy, than Spain, than the United States. And yet, you know, we have a prime minister who says that we're a great success. I just don't understand why there isn't the level of fury in this country that there should be because of this performance. Secondly, you talk about clear messaging, Jonathan, you're quite right. I am completely and totally confused and have been since the very beginning about what the government was saying. Wash your hands, don't wash your hands. Meet your friend, shake hands, don't shake hands. Go to Barnett Castle to see the sites, drive to test your eyesight. It is a complete mess. And at the end of the day, checking around today, I had to take a bus in London. 60% of people wore masks. The other 40% did not. Some people were eating on the bus. Some people were drinking on the bus, soft fruit, soft drinks. It is really very confusing. I think what Jonathan said is very true. If you don't have clear messaging, if you don't have consultation with all public authorities, if you have a parliament that doesn't sit for most of the beginning of the pandemic, you're going to have a mess, and I think we have a mess.
Thank you, Giampi. Next, so it's John. Yep, you've unmuted yourself.
Yes. Perhaps I can ask you, Fausto, how are we, the UK, going to coordinate our activities with regard to any future pandemic once we've left the EU? How are we going to work in the future?
Great, thank you. I can't see any more hands. Last chance to put up your... Ah, someone's waving at me using the traditional method. Veronica, if you could unmute yourself, you can have the floor.
One of the things that's really struck me about the general muddle of the approach in the United Kingdom has been that towards education and getting schools open. It should have been absolutely clear very early on when they closed the schools that if they were to open, you needed proper new facilities. We needed a national a campaign to provide additional classrooms, temporary classrooms. I speak as a former teacher as well as a former member of the European Parliament, and also lots and lots of perspex sheets to provide division between them. But there seemed to be no comprehension among our public school educated cabinet members that in state schools, class sizes tend to be about 30 rather than 12 or 15. And you do get the impression that in other European countries, they thought about these sort of things much earlier on in the process and have been able to move things on. And that seems to have been the biggest problem for us, that there's been no clear, coherent thinking in the entire planning process.
Absolutely, very good question. They manage Nightingale hospitals. Why can't they manage a few Nightingale classrooms? So this is going to be the final round of questions. So I'd ask our three panelists to answer those points and also to make any concluding remarks that they'd like to. Just before that, I would say if you're not a member of the Labour Movement for Europe already, please join. We would really love to have you on board. We hold at the moment lots of Zoom meetings and webinars, but we hope in the future to go back to meeting some people face to face. And I think it's so important that we keep the Labour Movement for Europe strong. The Labour Party needs to have its main European affiliate in a good position for that day when I eventually think that we will rejoin. Might not come quite as soon as some of us would like it to, but I think it will one day. So the way to join is to go along to our website, which is labourmovement.eu/join, and Harry's going to put that link for you in the chat as well, so you can go straight away from this meeting and join LME. So now I'd also like to thank our three speakers as well, because I know some people leave sometimes before the final round of questions, because I think it's been a really good meeting with hearing the kind of things that we don't necessarily often hear as a British audience. So for our to hear now finally from our three speakers, first of all, I'd like to invite Jonathan, then Brian, and then Fausto, so you know the order that you're coming in. So Jonathan, over to you. You need to unmute.
Hi, hello. What specifically can I comment on, sorry?
Any of the three questions that we've just had, or any concluding remarks?
Yeah, I mean, I think that, you know, the lack of clarity for me is the key thing. It's difficult. It's a difficult message to get across. And as we get into the COVID response, it becomes more difficult, more complex, because what's being asked is more difficult and more complex, and there's more variations of what you can and you can't do. And I think that the messaging around reasons why hasn't been strong enough to make sure that people understand why they have to do certain things. And I think that there's even quite a few people who don't really believe necessarily it's all necessary. So I do think there's a role to play for us, the Labour Party, in being able to, you know, add to that understanding of the messaging that's being put out there. And I think that we're doing some good work on that. I think there's probably more that we can do. And I think that the challenge for the UK is that, so even if the communications are clear, there'll be some who want to just do their own thing. And I think that in Italy, Greece, especially the southern EU states, there's more of a community mindedness around following the necessary measures. And you've got more police to actually enforce it, which actually makes it easier. I think the UK is in a very difficult place because police here police by consent. So when the messages aren't clear, and then when people go and do things they shouldn't be doing, it's quite hard to tackle that. And I think that's partly the dynamic we're in now, that poor messaging, politicians doing certain things, we know who we're talking about here, who sort of break the trust amongst people, and then just quite a challenge on how you manage people in the community or in the country who don't follow those measures, because our policing style is different. I think that that contributes right now to a risk as we go into the new normal, that we could easily see more spikes than many of our fellow European states, who I think are now managing it better than we have.
Thank you, Jonathan. Brian.
Yeah, thanks. I'll be quick. I'm going to very briefly go back to Kat's question from previously in relation to domestic violence, because I meant to come back to that. In Ireland, there has been a huge spike in domestic violence, so much so that the Department of Justice here teamed up with all the domestic violence and sexual violence NGOs to run a campaign which was basically entitled "We're Still Here," so that if people needed support or help, that there was a centralized phone number, and the state has provided a certain amount of money to facilitate that. Like, to speak to Jampi's point, you know, I think how there isn't more anger in the UK at how it's been dealt with is frankly shocking. In Irish public debate now, the UK is being spoken about in the same terms as the US, that it's Trump and Boris and how they've managed COVID is how the discourse is going here. You know, that's the perspective that's been put on it. And, you know, in some ways it's a shame, fixed parliaments, and you're so far from another general election, but, you know, it's continuing to be farcical how it's dealt with. One thing that really struck me, and Jonathan's talked about communications, and my background is communications, but in Ireland, like, we've made mistakes and we've done things wrong, particularly in relation to nursing homes and so on. But the messaging has been extremely tight, and it's been extremely honest, and it hasn't been politically led. Whereas in Ireland, there's been the formation of what's been called a national public health emergency team. Briefings are being done by medical professionals. When I turn on Sky News to the UK briefings, they're all being led by political ministers, which just strikes me as fundamentally wrong, because, you know, politicians always have meat in the game in terms of the outcomes. So, you know, that's just one observation. And, you know, I think, if I might leave you on one point, and sorry, I'll be very quick, but the question of social solidarity is, I think, a very important one. I can only speak to the Irish experience, but things that were done, which I never thought I'd see done here, in terms of eviction freezes. It's illegal to evict someone in Ireland at the moment. Rent freezes. It's illegal to put up their rent so that they might not be able to afford. And that has even extended to, say, traveller camps. So, you know, Irish travellers, Roma, have been included in that, and there's been a real attempt at making sure that there is an approach that's based on social solidarity across different languages, across different cultures, and across different minorities and ethnic communities. That information has been shared in as equal a way as possible, and resources similarly. Again, you know, I'm not saying we've gotten it perfect, because there has been huge mistakes, but certainly I think for going forward, I think that sense of social solidarity gets you a lot further when all actions need people to trust what the government is doing.
Thank you, Brian. And now over to Fausto, please, to sum up for us.
Okay, before answering to John, who made me a direct question, please do apologize me for my English. I have forgotten to say it before. Please apologize me for my English. I know that it's not good enough. Anyway, John, I know that UK is leaving EU, has decided to leave EU. This is something I cannot accept in principle, because my personal opinion is that without Europe, without European Union, there are no single countries in Europe that can be part of a common effort to improve our society and our lives within the world. So I know United Kingdom is leaving, but what I can say is that there will be a treaty, there will be some kind of agreement, some kind of written document, official document regulating the relation between UK and EU. This point of the coronavirus can be something to take into account when deciding the final version of this agreement, of this deal, of this piece of paper, because it showed us clearly that if we stay alone, we cannot afford, we cannot be able to take efficiently all the challenges that the nature is going to give us in the future. just imagine this. We had in the north of Italy brigades of doctors and of sanitary experts coming from Russia. We have no special relation with Russia. We had brigades of doctors coming from Cuba. We had people coming from all over the world. There's no need of an official relation or an official protocol of relation. This is something that when it happens, changes your life. And that's the way we should be prepared for the future, to change our common standards, what we are accustomed to consider normal and common standards, and to be more open in the future, because the challenge is global and nobody can answer only at national level.
Thank you so much, Fausto. So that brings tonight's meeting to a close. So my huge thanks to Eva, to Brian, to Jonathan, to Fausto, to Harry, our organiser for LME. Fausto, your English is brilliant. Please don't worry about it. And I'm sure everyone on the call will agree with me on that. Thank you for reassuring us that no deal is unlikely for us. And I think the key message from tonight's Zoom call is that this pandemic shows us that problems are global, and the only way that you deal with any problem, be they this global pandemic, be they climate change, be they the need to crack down on those multinationals who aren't paying their taxes properly, is to have cooperation and to have solidarity. And we in the Labour Party, and we who are pro-Europeans, definitely believe in that. So thank you ever so much to all of our speakers. Thank you so much to everyone here who's joined us this evening. Have a good night and hope to see you again soon. Thank you. Bye-bye, everyone.
Thank you. Bye-bye. Bye.